So Sal says, so my question is, they're having chest pain, so we sit them up, Fowler's position, apply oxygen, but they're still experiencing chest pain. We contact the doctor, right? And let's say their O2 is fine, and I don't know what the rest says, but okay. Before I address this question, let's take a step back. I want to point out something that you did, and it's not just you. I'm not picking on you. Thousands of students do this all the time, and this is why they struggle. You're given a question, you're given a situation, and you're given enough information to answer the question. But what happens is you start making up scenarios in your mind. You say, what if? And then you become Danielle Steele. You become an author. And so by the time you come up with your answer, you're answering a question that you made up in your mind, not the question that's been presented before you, right? So the question that we were talking about, which I already gave you the answer, you're going to sit that patient up every single day of the week. You're saying, what if? Don't do that as a nursing student. But let's go with this. You're saying, what if we sat them up? What if we gave them oxygen? What if they still have chest pain or shortness of breath? Then do we call the doctor? So here's what you're letting me know. You want to choose that call the doctor answer. So you want to choose that so bad. Let me tell you something. In nursing, it's rare that your answer, your priority, the first nursing intervention is going to be to call the doctor. Very rare. Why? The test writer, NCLEX, ATI, HESI, they all know the doctor knows what to do. They have a medical license. You're being tested because they want to know, do you know what to do independently? Now, there are certain situations you have no choice but to call the healthcare provider because there's nothing you can do at that point. If you're suspecting rupture of an appendix or a triple A, there's nothing that you can do for that patient except get that patient into surgery or get a certain medication that you need an order for. By all means, call the healthcare provider. But you got to say to yourself, is there anything I can do for my patient before I turn my back on that patient to go call the healthcare provider, right? The reason I cannot answer that question, if you would finally call the doctor, if all of these things happen, is because I didn't see any of the other options. Because I'll tell you what, if you had an option of looking at that EKG, or you had an option of looking at that O2 sat, guess what? You do those two before you call the healthcare provider. Do you see what I'm saying? So stop trying to make nursing cookie cutter because it's not. You cannot memorize this. You have to use your critical thinking. So depending on the options that are presented before you, maybe you call the healthcare provider next, but maybe not. I hope that was helpful to you.